Everyone. Yeah, it's good to have you on board again. It's another wonderful Tuesday, and yeah, it's good to see everyone. I hope we've been well since the last meeting, and I trust that life is treating us well. I don't know how everyone is coping with the pandemic and adjusting slowly with life. Comes with it. But I trust that with this program and the sessions, as we always come together and learn, I believe that it somehow empowers us, inspires us, and strengthens us to move on and be the best, or seek the best that we can do. So welcome for today's session. Apologies for starting a bit late because we had a very low turnout. So I didn't want us to miss, a great presentation that is gonna come. So a few minutes, about 3 minutes here to delay for that. So I won't take much time. I'll just go straight to introducing today's topic. So we're going to be talking about mental health, which is a very important topic, not just for this season, where we're going through this pandemic, but generally. In as much as we want to be well physically, health-wise, spiritual and other things, but our mental strength, mental health is so key to everything else. And we're going to learn more today from our one and only medical doctor, Dr. Zainab, but also she's going to be co-facilitating with another amazing lady, Miss Josephine. You've had a bit of her. Not a bit, but I think greatly of her in the previous session. So today they're going to take us through this mental health, how to be mentally strong. And I hope we can follow through, we can ask questions. Just make sure that by the end of this session you have learned so much, and most importantly, how you're going to work on that, how you can be mentally strong. So this is the chance for you to ask a lot of questions so that after that you can really get to action. So without further ado, I would like to welcome you, Miss Zainab. The floor. I hope you guys read the bio and went through. So
Mike.
Zainab, welcome.
Thank you, Felicia. Good evening, everyone. I hope you're all keeping well. So without further ado, we're going to start on our session on how to be mentally strong. I hope by the time we finish with this session, we'll have drafted some few tips on how to actually be mentally strong. Felicia, next. Okay, on this slide, our first slide, we have the most frequent asked question that we get asked every time, everywhere we go. How are you? And I'm sure most of us, hey, can you all hear me?
Yes, we can, Zainab.
Okay, so as I was saying on this slide, we have the how are you, the frequent question that everyone get asked every now and then. And fortunately or unfortunately, most of us prefer to say we're just fine. And we try to hide what we really are feeling inside, because one of the main reasons could be you don't want to feel rejected, and you want people to ponder further. So as we continue with the presentation, we will understand why some people opt
You just want us to
say
carry
fine.
each other the whole day and
Okay, sorry, Zainab. Josephine, please, can you mute your mic? We can hear some background noise just for now, and then you can chip in. Thank you. Please carry on, Zainab.
Can you go to the next slide? I hope I'm clear as I'm using. So our objectives for this presentation is for us to be able to define mental health and emotional health, for us to be able to understand the difference between mental health and emotional health, as most of us will tend to think it's one and the same thing, but we're going to see that there are some differences. I would also like to share with you some of the common mental diseases that we might come across, or might some of our relatives or family friends have, but they have not yet been identified with. And because of mental health, there are two key aspects that really go hand in hand with making us mentally healthy is developing our self-esteem and self-awareness. We're also going to cover about strategies of coping with stress. We're also going to discuss a bit on the effects of stigmatization and mental health, and how to get help when you feel you need the help. So first, we'd like to introduce, as we all know, WHO is the World Health Organization, and it has a constitution that defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In this definition, it's clearly that mental health it's a package of our health. You cannot say you are healthy without defining your mental status. So mental health is a state of our well-being in which an individual realizes his or her own abilities, where you can cope with the normal stresses of life and can work productively and is able to make a contribution to his or her community. So for one to be declared mentally healthy, they have to be able to cope with the normal stresses of life, and they're able to work productively. We go further and say that mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. On this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern of individuals, communities, societies throughout the world. Hence why we are here today to talk about mental health. So I'm also going to try and define emotional health. Emotional health, in short, is a state of positive psychological functioning. It can be thought to be as an extension of mental health, but it's an optimal functioning, end of thoughts, feelings, and behaviors that make up both our inner and outer worlds. So in short, emotional health is a person's ability to accept and manage feelings through challenge and change. So whenever you have any challenges in life, how you react to them, that shows how you're emotionally healthy. So you can be mentally healthy but not emotionally healthy, or you can be emotionally healthy but not mentally healthy. And we're going to discuss further on the differences of being emotionally healthy and not mentally healthy. I hope we are together and I'm not going too fast.
Yes, I hope we are. Guys, please let's use the chat to, to respond or something. Yes, please go on. I press next.
Yes, please. So there are three key differences between mental and emotional health. So the first one is how we process information versus how we are expressing emotion. So part of mental health is how well your mind processes and understands information and experience. In contrast, emotional health involves how your ability to manage and express the emotions that arise from what you have learned and experienced. So for example, you can be having a mental health issue, but emotionally you are stable. Maybe you're feeling depressed. I'll go further and explain what is the meaning of being depressed. But emotionally, you have that energy to actually wake up, regardless of how you're feeling mentally. I hope I'm clear. So that's the main difference between processing information versus expressing information. It goes further and say one can thrive while the other struggles. So an important distinction between mental and emotional health is that you can experience mental health issues while maintaining good emotional health and vice versa. For example, while struggling with mental health problems, like having little energy for daily tasks, you can still exhibit emotional health by finding effective ways to manage that lack of energy. This is when sometimes when you're having those depressive mood or mood swings, especially for females during their PMS stages, you're not feeling stable. But then emotionally, you try to find ways to make yourself have that energy. So maybe you're feeling depressed and you don't feel like waking up, but you try to look for stuff to do to create that energy. There we are saying that your mental health is down, but your emotional health is up. I don't know if I'm making sense.
Yes, you do. You do.
Okay. We continue to the next slide.
Okay.
So the scope of the two terms. Mental health is not only about how well you understand and process your experience. It also includes your ability to carefully reason through decisions and maintain a steady, focused attention span. The wide scope of mental health puts it in sharp contrast to emotional health, which has more focused definition of actively understanding and managing your emotion. So basically here on this, we're trying to say that first, your mental health is like it's a basket. So if your mental health is at par, you can also able to facilitate your emotional health. I don't know if I'm clear.
Yes.
Felicia and the rest, are you with me?
Yes, yes. Yes, we're with you.
We continue. So with that being said, I'm going to talk about the causes of mental disorders, which is what can cause you to have a mental health disorder. They're actually divided into three, which is biological, psychological, and environmental. On the biological part, sometimes some of the mental illness are hereditary. I think you guys, you've heard of people saying that, am I allowed to speak in Swahili?
Okay, there are some who might not understand.
Okay, I'll just speak in English. I wanted to use the phrase that we commonly use in the streets, especially in Tanzania.
Yeah, you can use it and translate it.
Okay, we usually refer to people who are mentally ill. I think the most common mental illness that people know is schizophrenia, which we call the mad people. So sometimes you find a family where they're all mad or they're having mental illness. So you just hear people saying that is a family of Wenda Wazim, which means that's a family of crazy people. So sometimes our genetic material, it matters. So some of these mental illnesses are hereditary. So you find that usually there are some studies that say that if you have on your maternal side, if the maternal sides have mental issues, there are chances for someone in the family to inherit these mental diseases, especially if you have the eating disorders. Sometimes it runs in the family. Like if the mother is having an eating disorder, you'll find maybe the daughter or the granddaughter like that. Then there's also brain defects or injury. When we talk about brain defects or injury, if you've heard of people who are having epilepsy, if most of you don't know, epilepsy is one of the form of mental illnesses. So it can, because that's why we're saying some of the mental disorders are biological. And epilepsy, it's usually caused sometimes for some kids, especially if you're a newborn and you're having, I can say, birth asphyxia. When during labor, the mother has issues and then the child is unable to get oxygen. So it affects their brain. Are we together?
Yes, yes.
Yeah. And another causes that can cause mental illness is infectious, such as certain bacterial viruses. If you've had meningitis, it's a bacterial disorder that attacks the meninges of the brain. And you find someone having a mental disorder due to that. And also most commonly, when severe malaria, if someone has severe malaria, they do get cerebral malaria, which is also one of the reasons for having a mental disorder. Also, if you have poor nutrition, because you actually need proper nutrition to be able to be fully healthy. So sometimes if you're having poor nutrition, some people, it affects their mental health. If you're exposed, sorry, there's a question.
Okay.
Can I respond to the questions later? Or
Yes. Please. You can have a little of a break after you've gone a few slides, and then we take a break and maybe address the questions, right?
Yes, please.
All right.
So another causes biologically is exposure to toxins. As you know, like mercury, especially if you're for those people who are working at factories, or ammonium sulfate, large amounts of that do cause mental issues for people. Prenatal damage is what I was trying to say, especially during birth or when the mother is pregnant and is not taking enough nutrients, or she has a disease that can be transmitted to the child. Sometimes it do causes mental disorders. So on the other part is psychological. Psychological is more one of the main reasons is trauma. We call it post-traumatic stress disorder. We're going to see it further on the next slide. or stresses. If you cannot handle your day-to-day stresses, it's going to affect you. And that is, stress is the most common factor for people to have mental disorders. We'll see on the next slide some of the common mental disorders, and there you'll be able to understand fully how psychologically trauma or stress can bring about mental disorder. Another thing that is very common that can actually cause mental disorder is sexually, physical, or emotional abuse. If you, no, I can say if you've experienced, but if you've had stories of you've met people who have been sexually traumatized, most of them in the long run end up having either personality disorders, or they're going to have depression because of what had happened to them. Because what happened to them, like a sexual or physical emotional abuse, is a traumatic experience that actually affects how your brain functions and how you relate to people or your day-to-day activities. On the next slide, we're going to see more about that. Also, neglect, lack of support from friends and family. Sometimes if you're not supported by your friends, it's going, not only your friends or your families or your colleagues, especially for our adolescents or our youths, those who are around 15, 25, during that phase where you want people to fully accept you, or where you actually you're discovering yourself, you're put in a different field, or maybe you're a teenager going to adulthood. It's usually a period of mixed emotions. So during that period, if people don't accept you, sometimes it actually causes trauma, which brings about mental disorders. We'll see further how this neglect and lack of support comes in creating these mental disorders. Also, family or school violences, poor social relations, early loss of close or immediate family members or their friends. They're actually also they are triggers of having a mental disorder. Then we're going to look at the other causes of mental disorder, another factor, which is environmental. So this environmental is actually broad. It could be a dysfunctional family, and the environmental and psychological also, they go hand in hand. If you're having a dysfunctional family, it also brings neglect and lack of support from the family. Death or divorce, if you lose your loved one, most of the time, if you're not able to handle or express your feelings at that given moment in time, it can lead to having a mental disorder. And the most common one, as you'll see further, it's post-traumatic stress disorder. Here I will break a bit and I'll try to give an example of my own personally. I lost my dad about 11 years ago, and I was really close to him. And his death actually affected me, but by then I didn't actually understand it. It was way before I went to medical school. So I didn't really understand because I was really attached to my dad. But the environment that I was in after his death, because I wasn't there when he died, I was in school. So I came back later after his burial and all that. But that impact of having to lose him in the environment it actually led to me having anxiety, which I still have up to now. We'll go further when we're discussing the common mental disorders. And I also suffered from post-traumatic stress disorder. So our environment also plays a big role in our mental health. And also social cultural expectations. This, I might say, for us, especially here in Tanzania, it plays a big role because mental health is a bit taboo to talk about. Like, you can't really come out. We have this understanding and we have this idea that people who are mentally ill are the crazy people that need to be locked up. And you being normal, or like, okay, like me, I'm a doctor. If I say I have a mental illness, people will be like, oh, but you're a doctor. How come you have a mental illness? Like, you're not expected to have. So if you're in that environment where you're struggling with these stresses and you cannot actually come forth and say, you know what, guys, this is stressing me, or I don't know how to handle this. So it's one of the triggers that can cause mental disorders. Because if you cannot express yourself, as I said in the first slide, how are you, and you answer fine. But behind that fine, there's many other suppressed emotions that people suppress them. So our environment also plays a role in creating these mental disorders. Also, another thing is substance abuse. majority of the mental disorders here in Tanzania, I can say about 70%. I'm not really sure of the official statistics as per now, but it shows that a lot of drug addicts, they end up having either a psychosis disorder because caused by the addiction. So also the environment, that could also be environmental or biological. Exposure to toxins, which are these drugs, and also the environment that you're in. Schoolwork, if you cannot balance your schoolwork and you feel stressed, and usually we find it in our high school, maybe when you're about to write your what can I say, this university entrance exams, or you're jumping from one semester, 1 year to the next, and you're feeling overwhelmed. If you cannot handle that stress, it can also lead to you having a mental disorder without you knowing. And we'll see how we can able to identify if we have this and not. And also another thing is romantic failure. I'm very sure half of us have experienced heartbreak, and we know how that feels, that period of mourning I can say the loss of your loved one, but usually when you're attached to someone and then all of a sudden you have to detach from that person, it affects us mentally. So we go to the next slide. Sorry, Felicia. Common mental illnesses. As I was saying, our common mental illness, I tried summarizing them. There are so many, but these ones are the most common ones that we find through our day-to-day. The first one is the most common one, is a psychotic disorder. This psychotic disorder is defined as a mental disorder characterized by disconnection from reality, which I was talking about schizophrenia. These are the classic wanda wazimu, or the mad people we see in hospitals or in the streets. The second one is mood disorders. I hope all of you have heard about the Kanye West saga. Does everyone know Kanye West?
Yes, but tell us about it, maybe kidogo.
Okay, so we all know right now Kanye West wants to vie for the US presidential election, and he had a meltdown. He is a non-patient with bipolar disorder, which is a mood disorder. So mood disorders is usually that it involves emotionally disturbance consisting of long periods of excessive sadness or excessive elation. So in the case of Kanye West, who is having bipolar disorder is divided into two: hypo and hyper, where you feel you can be really, really happy and you can be really, really sad. It's like type 1 and type 2. So when you're having mood disorder is where you're having an emotional disturbance. You cannot handle the stresses that you are given. So for his case, as I was saying, Kanye West, it's believed that the death of his mother affected him in the whole American culture of the Black Americans and all that. And another mood disorder is a common one, which we all have. It's a clinical depression, where it's said about 1 out of 4 people every day or every year is diagnosed with depression. So depression is one of the most commonest mental illnesses in the world. Then we go to the anxiety disorder. Anxiety disorder is a mental health disorder characterized by feeling of worry, anxiety, fear that are strong enough to interfere with one's daily activities. You guys have heard of phobias. When I mean phobias is when some people, they tell you that I cannot stay near a cat because they scare me. That is phobia. And that is one of the types of anxiety disorder. There's also a generalized anxiety disorder where you cannot function well because you're very worried. You feel like everything that you do is not right. And some people end up having a panic disorder. Has anyone ever experienced a panic disorder? It's usually when you are stressed and you can't handle it, or you have to present. Actually, I had one just before this presentation. I was very worried if I'll be able to facilitate this. So anyway, the next one is dissociative disorders. These ones are mostly where there's disconnection between the lack of thoughts, memories, and surroundings. If you've heard of something called multiple personality disorder. Then we having the eating disorders, which is very common in America, but here in Africa or sub-Saharan Africa, it's not really that common, or it hasn't been really diagnosed much, because as you know, we like eating, or we can handle our eating. So eating disorder is either bulimia or anorexia. Bulimia is where you force yourself, after eating, you force yourself to purge or to vomit. You feel like if you continue, you eat more than you can handle, then you force yourself to vomit. Anorexia, on the other hand, is where you starve yourself, not intentionally, but because your brain is telling you that you are too fat, or people are telling you you're fat. So your mind has in tuned itself to see food as an enemy. We also having sleep disorders like narcolepsy, where people sleepwalk during their sleeping. That is one form of the mental disorder. It's not rare per se, it's common, but most people don't have an understanding to it, and you don't find people, especially when we go further, we'll see that most of us don't really know how to identify these disorders. So it's very hard to find someone come up to the GP, general practitioner, complaining of these disorders. The last one, but not the least on the list, is personality disorders. These personality disorders are rigid and unhealthy patterns of thinking, functioning, and behaving, where you're having trouble perceiving and relating to situations and people. Usually people with personality disorders, they usually, I can say, they're perfectionists. Some of the people who are perfectionists, they do have a personality disorder. They only see black and white. They cannot see gray. We can break from there and see if we can answer some of the questions before we proceed further.
Oh, great. Thank you so much, Zainab. I think that was a great, interesting ride through being aware of this, mental issues. And I think, yeah, for once you've set, the stage for opening our eyes and understanding these issues. And just as you say, there's a lot of stigma and unawareness, and sometimes even we go through these moments unaware, and really, as you tell us, how to really address or take care of ourselves. So thank you so much. I don't know if there's a question. Okay. So I'll read out the first questions, and then people are keeping on posting. So Pamela asked, is there any difference between these words, madness, craziness, psycho, mental retarded?
Actually, I think those words are, like, we can say, in the medical jargon, they don't exist, but in our English dictionaries, they actually mean one and the same thing. They're almost synonymous to classify people with mental illness. So because people don't really know the differences of the different mental illness, they just summarize everyone who is experiencing these disorders as either you're crazy or you're mentally retarded. Most of the time, people who are classified as mentally retarded are like the kids who have either epilepsy or cerebral palsy. These are mental illnesses are caused by biological factors. So I feel like they mean the same thing. They're trying to explain the same thing, but when you come to the broader picture of mental illnesses, you might be classifying someone as mentally retarded, but they're actually just having an episode of bipolar, or they're just having an episode of epilepsy.
Okay.
Yeah, so they're just words used in English to classify these mental illnesses.
Okay, thank you for that. So somebody else is asking, what is causing sleeping disorder? My brother experienced it twice. Any insights on that?
Okay, sleeping disorder can be caused by multiple of things. As I said from the chart, it could be environmental, it could be biological, or it could be what's this thing? Psychological. So most of the time, sometimes the sleeping disorder is caused by psychological. When you have undergone stresses, or maybe you have had because when we are asleep, a part of our brain is active. There's something that's called REM and RAM, like the memory. So when people are experiencing these sleeping disorders, part of their brain is awake instead of being sleeping, like the active. So whatever you've been going through during the day, or whatever, something that has happened to you in the past and you cannot express it, it's in your subconscious that is disturbing you. Then you'll find people going through that. It's actually treatable. Most of the time it's treated by, we have two kinds of doctors who deal with mental illnesses. We have the psychiatrists and the psychologists. So most people who have sleep disorders, they see a psychologist who is like a kind of behavioral doctor who's going to sit down, because with all these mental illnesses, we have something called mental status evaluation chart.
Okay.
So we have like about 10 factors that they are going to ask you about your mood, your memory. Okay, so from there, the psychologist is going to sit down and try to probe you further. What is making you be up when you're supposed to be sleeping? And there are medications that are given to actually sedate these people to reduce activeness of their brain. So if you do have a family member who's experiencing that, it's good to go to a GP, your general practitioner. They go through the mental evaluation status, and then from there, the GP is going to try and figure out what is actually causing it, because different people experience different type. We might be having the same problem, but the way my problem is being perceived or the treatment plan to mine is different from yours.
Okay.
We have like the cognitive behavioral therapy. So once you see the doctor and they've been able to go through with you, they've done the mental assessment status, then they are able to curtail your treatment according to your needs. So please don't feel shy. If you're having that, your sibling, I hear someone said their brother or someone, just take them to the GP, who will refer them to the psychologist to probe them further and find ways to help them. I hope I've answered the question.
Yes, yes. Thank you so much. So I will move on to the next one. This is Lucinda.
Okay.
She asked, is eating a lot a form of a mental disorder? Like someone who wants to eat all the time, regardless of hunger, stress, happiness, etc. They can't seem to stop themselves. Is that a mental disorder?
Yes, it can be classified as a mental disorder, because when we're talking about a mental disorder, we're trying to say, I think I should have said it in the beginning. Our minds, like any part of our body, falls sick. The same way you have a flu, or the same way you'll have a tummy ache, it's the same way your mind sometimes gets sick. And that doesn't mean if your mind is processing these things differently, means that you cannot get help. So sometimes your emotions and your mental status is not at par. Maybe you're going through, I know sometimes some people, if they're going through something, they tend to eat a lot. Maybe they are depressed. They they call it comfort eating, where you are like, I'm feeling depressed, or I'm feeling low. Let me not use the word depressed, but you're feeling out of mood. You're not as happy as you're supposed to be, or you're not joyful, or things are not going right. So you sought something to comfort you. That's why some people, obesity is one of the eating disorder. And most of the time, research has shown that those people who are obese, or they're eating all the time, they have a mental health issue that is making them eat. I don't know if I'm clear.
Yes, yes.
Yeah. So something might be disturbing your subconscious, or something might have happened to you. Usually, we have a lot of people who have undergone sexual violence, so they tend to eat a lot to try to make them to feel invisible. So they have this understanding where if I eat, I become fat. The predator will not be able to attack me, because now I will be ugly or be too fat to attract such. So eating disorders can also be a mental illness that are caused by something that has happened to either in the past or currently that is happening to you. I don't know if I'm clear.
Yes, yes. I believe Lucinda is well answered on that. Thank you so much, Doctor. So I will move on to Next question. Maybe we can have one more question and then you continue, and then we'll come back to the questions. Is that okay?
Yes, please.
Yeah. So, okay, this is from Samuel. He asked, can impulsiveness be a mental disorder? And then, how can one know that they are bipolar?
Okay, so impulsiveness can be a mental disorder and can be classified on the anxiety disorder, because once you have the anxiety disorder is where you cannot feel, you feel like you have, as I explained, anxiety is characterized by feelings of worry or fear that are strong enough to interfere with one's daily activity. Or it can also go to the mood disorder. So, because most people who are having mood disorders are usually impulsive because they cannot control. Like when we go deeper into bipolar, these people, one of the characteristics of a person who has bipolar is impulsiveness. You find that the person, just when they're having that episode or they're having that outbreak, they will spend all their money, or they'll want to have a lot of sexual activities, or they will drink, or they will smoke. Like they will do things on impulse because they cannot control how they are feeling. So yes, impulsiveness at a illness. And how do you know you're bipolar? As I had said earlier, with all this mental illness, you actually require to go through to your general practitioner. When we go further, we're going to see how sometimes these common symptoms that we experience, maybe you might be having migraine, or you may be having a bloated tummy, or you might be just feeling generalized body weakness. And once you go in and your GP, I think most of the time, I can say even to me, sometimes because of our health systems, the way they are, one doctor handles a lot of patients, we tend to neglect doing our mental status evaluation. So you go in, maybe you're feeling dizzy and whatnot. We try to treat what you're saying. We don't probe further. And most of the time, you'll find a lot of people who are having mental illnesses, it takes so much time for them to be diagnosed. So for one to know they are bipolar, as I said, bipolar disorder has two types, type 1 and type 2, which is hyper and hypomania. So when you go in and there's that, we usually have, as I keep repeating it, there's that structure that you have to, like, it's a questionnaire. So once you fill in that questionnaire, and your symptoms, whatever you're going to report, goes hand in hand with the classification of bipolar, because there are groups in medicine. We have different classes and groups of identification of diseases. So with these classifications, once you fit the criteria, then you can be diagnosed with bipolar. And one of the most known characteristic of a person with bipolar is impulsiveness. That's why I brought you guys the case of Kanye West, for those who are interested to know. Like when he went to speak during his presidential campaign, the things he said during that time, in his normal state of mind, if he wasn't high on that, if he wasn't on a maniac episode, he would have said that. So once you are in that state, or you're having that episode, you say anything, absolute and everything. You don't have like a filter. You feel like you need that high to make you feel good. I don't know if I'm making sense there.
Yes. Yes,
And I
you
hope
are.
I did answer the question.
Yes, I trust Samuel is well answered. So thank you so much for addressing the questions very well. So we'll ask you to please carry on, and our dear participants can just keep on posting the questions, and then we will just have another break. And then, because I think you have more to share, so that we also learn from what is there, and then we'll get to the questions again. So please, if you can carry on.
Okay, go to the next slide.
All right.
Okay, so there are two important things that I felt that I should share with you guys that actually do affect our mental health in general. And one of the things is self-awareness. And I hope by the time we finish with this topic, we're going to be able to develop our self-awareness. Once you are self-aware, it actually does help with your mental health. It does help making you more mentally stable. So what is self-awareness, if one is to ask? So self-awareness is the ability to see yourself clearly and objectively through reflection and introspection. While it may not be possible to attain total objectively about oneself, there are certainly degrees of self-awareness. It exists on a spectrum. So when I'm saying self-awareness, it means that based on, it's not an idea, it's how you perceive yourself, it's how you can present yourself, or how you believe who you are. Like you are aware of your capabilities, or you're aware of what you bring to the table. And once you're aware of these things, once you're able to put yourself in a, I can say in a platter, but put yourself in a plate and analyze yourself, see your skills, see your weaknesses and your strength, it actually helps you to be able to present yourself properly. So like once you look at yourself and I know most people, okay, myself per se, I struggle with presenting myself towards people. I'm socially awkward, if I might say. So it took me a lot of time to be able to figure out my strength. If I'm put if I'm put out there, if I'm put in a place, in an environment where I have to interact with people. So I started analyzing where my strength, what is there that I can actually use to converse with these people and to help me not feel awkward or left out. Because once you're socially awkward, it really takes a lot of time for you to be able to engage with other people. So when you're self-aware, you're able to internalize and you're able to visualize yourself objectively and see exactly where your strengths are, where your weaknesses are, and you focus more on your strength to build yourself. So maybe in a work environment or at school, there are different subjects or there are different stuff that you're good at and some things you're not good at. So when you're self-aware, you tend to build all your energy on your strength. And once you do that, as we saw in the previous slides, causes of mental illnesses, one of them is our environment. It's a trigger. So once you're comfortable with your strengths, once you're comfortable with what you're bringing to the table, it helps you to be mentally healthy. I don't know if I'm making sense in that point.
Yes, you are.
Yeah. So I'll go to the 5 ways to increase your self-awareness. First and foremost, it creates space and time. As I was trying to say in the previous slide. So if you want to be fully self-aware, you should create space and time. You find an environment where you can be able to fully show your strength. You should also practice mindfulness. When I say practice mindfulness, I think most of you have heard of yoga and how helpful it is. So to be able to build your self-awareness, you must have that time for yourself. Maybe before you start your day, you already have your schedule of what you are supposed to be doing in the day. And sometimes you don't have that energy to go through all this stuff that you have to do. But then you can prioritize things that you feel like, these things I can do today, and by doing these things, I'll be fine, or it will not disturb my inner peace or whatnot. So when you're practicing mindfulness, you're choosing exactly what you want to do at what time, and you are exercising, like, what's the English word for it? When I remember it, I'll say it. Sorry. Okay. Then the third thing is journal your awareness. Like every day, it's good to keep a diary. I know most people are lazy, but sometimes documenting important moments in your life. Right now, we have social media, which is, in a way, it's harmful, I feel, because it's now bringing a lot of competition and it's making people perceive themselves differently. But sometimes it's good to journal your awareness. It's good to write down how you feel on a daily basis. It's good to share your progress and your success. It's not harmful to write maybe today I failed my exam or today something was hard. So it's good to be aware, to internalize everything that's happening to you. Another one is practicing listening. I think this is the hardest for all of us. Or maybe it's hard for me. Sometimes in situations where you're supposed to listen or you're supposed to lend an ear. Sometimes some people, they don't need advice, or they don't need to hear you advising them or telling them what to do, but they just want you to listen to what they're saying. And it actually does help. So by practicing listening, it actually helps you internalize how you are, or how people look at you, or how people perceive you. Because once you become a listener, you're able to be the third party. Like, you're able to visualize someone's yourself or another person's problem from a third eye. Then the last one is gain a different perspective. I'm sure sometimes we want to do work and whatnot. We know what we know, but it's good to be able to find other person's opinion. When I think self-awareness, it enables you to accept your faults. If you are wrong, if someone comes and say, hey, Zainab, you've done this and this that hasn't gone well with me, and you accept it, you've taken that different perspective of who you are from what you think you are from someone else. It actually helps to increase your self-awareness. In the long run, it helps you be mentally healthy. Next slide. So I'll go through this fast. Benefits of self-awareness, as I said. 1, it makes one more proactive. It boosts your acceptance and encourages positive self-development. Another one, it allows you to see things from the perspective of others, what I had actually said earlier on. It helps you practice self-control, work creatively and productively, and experience pride in ourselves and our work, as well as our general self-esteem, which I've actually said earlier on. It also leads to better decision-making. So if you're aware of who you are, what you bring to the table, you'll be able to express yourself better, and you'll be able to make correct decisions that are well tailored to your situation. So maybe if it's in a school project, or you want to look for a job, like when you're going for a job interview, if you are self-aware of your strengths and your capabilities, it actually will also help you to boost or sell yourself, because you'll be able to write a good CV or a good bio about yourself. It also makes us, as I was saying, better at our jobs, better communicators in the workplace, and enhance our self-confidence and job-related well-being. Next slide. So another aspect that is also very important, and it goes hand in hand with self-awareness. So if you're self-aware, you can it actually increases your self-esteem. There's a chart, there's a hierarchy of needs that we actually talk about in psychology, where these two, self-awareness and self-esteem, is actually the fourth or the fifth at the hierarchy, where the first one is our basic needs. So as the psychologists who are going on and people are discovering about mental illness and mental health in general, they discovered that self-awareness and self-esteem, actually, they come higher in our basic needs. Like, of course, you need your education, your food and shelter, but then you actually need to be self-aware, and you need to have high self-esteem to be able to function properly in the society. So what is self-esteem? Self-esteem is a person's sense of self-worth or personal value. It's how you see yourself, or how you feel you are, or how you perceive yourself to be. It involves a variety of beliefs about yourself, such as the appraisal of your own appearance, beliefs, emotion, and behaviors. So at this point, your self-esteem plays a big role in determining if you're going to be mentally healthy or mentally unstable. In what way, you might ask? Because if your self-esteem is on a higher end, even if you've gained weight, or even if people feel you are chubby, but because the appraisal that you have of your own appearance, it's at a higher end, it will not affect you. That's where you see people will not be having eating disorders, because you are comfortable in your own skin. I'm not saying you should be obese, but I'm trying to say if you have a high self-esteem, it provides an environment to make you mentally healthy. So actually there are factors, as I was saying, that influence our self-esteem. Genetics. As we all know, a lot of things that happen to us are hereditary. So sometimes studies have shown that if in your family people have low self-esteem, somehow, some people tend to inherit these traits. Also, your personality. That's why I was saying your self-esteem actually goes hand in hand in you being mentally healthy. When I was talking about the personality disorders, and I described what personality disorder is, and I said it's feelings, or it's characterized with where you are being you're being rigid, not rigid, but you're having trouble perceiving and relating to situations and people. So if you're having a personality disorder, of course, your self-esteem will also be low, because you don't know how to react to your environment, or you don't know how to interact with the people around you. Life experiences also. If you have had trauma or something has happened to you, it can also lower your self-esteem. As I was saying, your environment. If you're having parents or family members always looking down upon you, it will lower your self-esteem, and in the long run, it will create other mental illness. Of course, your age, your health, and your social circumstances also play a huge role in building your self-esteem. Next slide, please. So here I'm going to talk about practical tips on how to increase self-esteem. From self-awareness, the first thing, we always have to journal. As I was saying earlier on, it's good to have a diary. I know people think diary is like teenager stuff and whatnot, but you can also have just a journal on your phone where you actually write, or you can actually write all the positive traits. I think in one of the assignments, it was one of the assignments where you have to write about yourself, like you're positive, what you feel is good about you. So one of the ways to build or to increase your self-esteem is to set realistic expectations. You know, they say expectations is the mother of all disappointments. So if you create huge expectations for yourself, and if you fail to achieve these expectations, you will be disappointed. It will lower your self-esteem. Like this is like it's like a chain. So if something goes wrong, the reverse also, the rest of the stuff also goes wrong. So you have to be able to balance all of it for you to be balanced wholly. Something that most of us suffer from. I know Felicia also suffer from this, being a perfectionist. Like most of us, we want to be perfectionists. I know we can never be. We can be close to perfect, which is a good thing. It helps being perfect, but it should also not hinder you. You should also be able to allow yourself to make these mistakes and learn from these mistakes. Sometimes it's good to make a mistake and learn from it. Be willing to explore yourself. Discover yourself. As I was saying, write a journal. Write everything about yourself, your strength, your weakness. See how you can work through with what you have. Be willing to adjust your self-image. Stop comparing yourself to others. These last two things are very key, especially in the world of social media, where people are posting different things about themselves. It kind of makes us, if you look at yourself and you look at another person and you feel like, okay, we're the same age, we're supposed to be at the same stage in life, but I'm not there. So it sort of makes you start looking down upon yourself and lowering your self-esteem. In the long run, you might start having depression, or you might be having anxiety. Next slide, please. So I'm going to go really fast about stress, because stress is one of the things that actually causes all our other problems. As you know, stress is a feeling of emotional or physical tension, and it's our body's response to pressure from situation or life event. It varies from people to people, how something that can affect you, maybe it will affect you, but it will not affect me. So that's why it varies to your social, economic circumstances, our genetic makeup too. When we encounter stress, biologically, it stimulates stress hormones. And I'm very sure all of you went through biology class where we've heard of the adrenaline rush, which is flight or fight, where maybe you see something, a stressor, maybe you're scared of dogs and a dog barks at you. Of course, your body will react. You either run or you most definitely you'll run. This can be beneficial reaction by helping us push through situations that can be nerve-wracking. However, there can be times where it becomes excessive and too much to deal with. I hope I'm clear on that slide. I'm trying to work within the time limit.
Yeah, perhaps we can have some time to talk about it, maybe through questions.
Okay.
Yeah.
So here I tried to highlight for you one of the world's most stressed countries, according to the study that was done in 2018 by Statista. As you can see, our beloved country, Tanzania, is number 3 of the world's most stressed countries. I don't know why we are number 3, but I hope after the end of this presentation, we are able to actually reduce that. Next slide, please. So I'll go quickly through the symptoms of stress. As I said before, the way our body responds to different stressors is different. And that's why I kept insisting that if you're feeling a certain way, it's good for your GP to fully conduct a physical examination and an oral examination, like take a proper full history. So some of the symptoms of stress could be trouble concentration, headaches, anxiety, anger, stomach problems, fatigue, decreased sex drive, skin irritations, muscle tension, teeth grinding, apathy. So all of this can be symptoms of stress or can be a symptom of another disease. So sometimes maybe you are fatigued, could be you are just having a viral infection or a bacterial infection. But we are required as GPs to probe further, to rule out all the causes of this. And as we had seen in the previous slide, our country is among the highest of the stressed. So that means we're not doing our jobs well. Continue to the next slide. So I'm going to talk about ways to cope with stress. The first and most important, you have to identify what is causing this stress. So you have to identify what is making you feel the way you're feeling. So maybe you're in an environment, or maybe it's a group of friends, and one of the friends is always commenting on how you look or commenting about your physical appearance. That is actually a form of stressor, because it affects your subconscious mind. It affects how you perceive yourself, and also affects your self-esteem. So the most important way of coping with stress is to identify what is causing the stress. And most definitely, after you've identified it, the next action is to remove it. It's good to remove, because if you don't remove it and you're continuing stressing yourself, in the long run, it brings a lot of other problems. Then another thing is to review your lifestyle. I think I'm repeating myself by saying that we have to sort of have our own, if you keep a journal, it's a good thing, because it enables you to express exactly how you feel. It enables you to have a big overview of who you are. Because once you write down everything, your strengths, your weakness, your achievements, or your goals, it enables you to focus on the most important things in life. And by doing that, you're actually avoiding those things that are less important, that can cause stress to you. The third one, no man is an island. So you need to have a supportive environment. You need to find people who have the same goals as you are, who support you. Like a lot of us or a lot of people experience mental illnesses, or because stress is the biggest factor of mental illnesses. Either could be biological or could be environmental. Actually, it goes in on the environmental cause. Stress is one of it that causes mental illness. So if you don't have a support system, if you don't have people to cheer you on, we all need people to cheer us on, to support us, to pick us up when we are down. Again, eating healthy. It's always emphasized we need to eat, to have a balanced diet. Exercise. Exercising does help. I don't know if you feel tensed. Sometimes you're feeling like you lack energy, or you're feeling muscle tension, or just feeling uneasy. You can just take a walk. It's recommended every day to have at least 30 minutes of brisk walking or just slow walking. It actually helps you reset. It actually helps your mind to relax and reflect. Take time out. When I say take time out from things that you find they're not aligned to your goals. Especially, I keep going back to social media, because I feel like, not even I feel, studies has shown that social media is really causing a lot of problems in people's perceptions of themselves and their mental health. So if you feel like whatever someone is posting, it's affecting me, it's a stressor to me, unfollow that person or take time out from having that stressor. Be mindful. 8 hours a day of sleep is good, and don't be too hard on yourself. Don't be lax on yourself, but also don't be too hard. The last, and almost we are winding up. We are going to talk about mental health and stigmatization, which is very common in our country and everywhere in the world. As I said before, 1 in 4 people in the world will be affected by mental neurological disorders at some point in their lives. So imagine 1 in 4. So around 450 million people currently do suffer from such conditions, placing mental disorders among the leading causes of ill health and disability worldwide. I think statistics in Tanzania, it says about 20 million people out of the 55 or 60 do have a form of mental illness. So as I said, treatment is available, but almost 2/3 of these people with non-mental disorder never seek help from a health professional because of stigma, discrimination, and neglect. They prevent care and treatment from reaching people with mental disorders. So this is a statement from World Health Organization that says that 2/3 of people known with mental illness might never get treatment because of stigma. So less than 1% of the Tanzanian health budget is spent on mental health. So you can imagine, less than 1%. So of the estimated 2.5 million people, Felicia, go back a bit.
Sorry.
Yeah. The last sentence is very important. Only 20% have access to mental health services. As you know, I think we have, or here in Tanzania, we have Dodoma, Mirembe, Muhimbili, and here in Zanzibar. Like the hospitals that actually have these mental health facilities are very few, because even the budget that is to fund this is very limited. So you see how having mentally healthy people is very hard, because we are not really focusing on this mental health issue. To the next slide. So here I'm going to review steps to seeking help. So if you or someone you know has a mental health problem, there are ways to get help. Studies show that most people, they get better. I'm a living example of that. And they do recover completely. So the first help is being aware. And how are we aware? It's by getting this information that we've given or we've shared here today. And another thing is accepting that I actually have this problem. You being aware that, okay, maybe you've discovered that maybe certain things make me feel uneasy, or maybe I'm very impulsive, or maybe I have a problem expressing myself. Like when I'm saying you're self-aware, you already know your weaknesses and your strength, and you already feel there's something wrong. We always know. It's just that because of the environment around us, we are unable to seek the help because we don't know how to start. So being aware that the help is needed, you accept the help offered, and you find a support system. So these three things are very key in seeking help and getting the treatment needed. I think I'm done. Felicia?
Yes.
Next step, so that we're within the time. I think I'm over the time.
Okay.
We're done. Go to the last. There was a poem that I wanted to share.
That one?
Yeah. Yes. I think this poem really, I like reading it when I'm feeling really down. It's called Little Stones at My Window. It sort of helps me believe that, at the end of the day, this whatever is happening will not last long. And of course, having a support system and whatnot, it actually helps me. So I shared it with you guys as a form of appreciation, and I hope it actually touches a place with someone also who might be feeling low or depressed, or is not feeling okay. Thank you.
Thank you so much. I wish you read for us the poem.
All right.
Yeah, I mean, yeah.
Okay, once in a while, joy throws little stones at my window. It wants to let me know that it's waiting for me. But today I'm calm. I'm almost say even tempered. I'm going to keep anxiety locked up and then lie flat on my back, which is an elegant and comfortable position for receiving and believing news.
Oh,
So it
that's
actually, yeah, it actually just, I don't know, it lifts me up sometimes because I believe that that joy will come. It will, as it says, it throws little stones at my window. So it actually gives me hope that this phase would pass and something better will come.
okay. Thank you so much. That was a great ending and encouraging one, strengthening, I believe. Thank you so much, Dr. Zainab. And that was a very wonderful presentation. It was enlightening, a package of knowledge, new information to some of us, but also it's a moment also of reflection and just realizing, it's like a self-check. you being, it's like, I think we've been getting a free consultation today from a medical doctor for free, right, guys? Yeah, so this gives us a basis, and I like how you touched on self-awareness and self-esteem and how important that is. And I believe, yeah, with most of the participants here who have been following since we started, we've had a session on self-awareness and mindfulness, so all these things, that it's very interesting to connect in terms of the medical perspective of it, but also, important for our mental health. So yeah, it was for me, it was really interesting and powerful. And yeah, some of the things were like, when you say keep a journal and look at yourself from outside and things like those. So yeah, I tend to do them sometimes, not consistently, but it just encouraged me to do it more. So yeah, so maybe I'll just get to the questions, and if Josephine has any additional or anything to add to this as well, please feel free to stop me and just come on board and share. The floor is yours. We have some 18 minutes to go. So maybe I can continue with the questions that were asked earlier. And yeah, and then we will see if there is any additional thing. So I will continue from where we ended. There was a question from Juliet. She asked, "What are the signs of a perfectionist?" Okay, what are the signs of a perfectionist having a What are the signs of a perfectionist having a personality disorder? Or how are you able to tell they are at the borderline?
Okay. Usually, when you have a borderline personality disorder, or you're having a personality disorder, as I said earlier on, you only see white and black. You don't see gray. I don't know if I'm making sense. Like when I'm saying you're only seeing white and black, like they are two distinctive. Like for you, you see things in a different light or in a certain way, and there's no way but that way. So even if someone is telling you it's this way, to you, because you're only seeing it in only two spectrums, where it's either white or it's either black. It cannot be any other shade or gray. I don't know if I'm making sense. So usually people who are perfectionists, I'm not saying all of perfectionists do have personality disorders, but majority of them, because they are having difficulties in associating with the society or the environment around them. So they want things to be a certain way. Like you want your bottle of water to be tilted this way, or the cup to be a certain way. So, or you want, when you want your seat to be in a certain angle, and you will do everything for it to be in that angle. So we can say that when you're being a perfectionist, sometimes some people tend to have those personality disorders because they cannot see things in a different way. I don't know if I'm making sense.
I think you do, Juliet. I hope that gets clarified.
Yeah. So not necessarily that those people who are all perfectionists do have a personality disorder, but studies have shown majority of people who are looking for perfection do have a personality disorder. Because as we all know, there is no perfection in this world. There'll be minor things that will go wrong. But people who have personality disorders, they cannot handle those minor defects. They want it to be perfect. And these people do struggle a lot in relationships, because as you know, different people react to different things differently. So if you do have a personality disorder, most of the time, it's very difficult for you to handle relationships, because one, you do have expectations. You do have your goals, or you do have certain things that you want to be perfect. But as we all know, there's no one who's perfect, or there's no stuff that is perfect. I don't know if I'm making sense.
Yes, you do it. And I think, yeah, to add to what you're saying, it all goes back to self-awareness and, yeah,
Yes.
like, some standard that whatever you have set, but also, you have to look at it from outside. Is it attainable? Is it something can live with? And all those factors. So I completely agree with you. And it's very important, to look at things, yeah, from different perspectives. Like, what are the limits? You should be able to know I'm crossing the limit here. and also maybe sometimes we need to have people around us who can give us honest feedback. Like, here you're being too much. Like, yeah, like when people tell you, like, this is unacceptable, or this is beyond the required point. So those feedback really, and if you're self-aware, you are okay to get feedback and things like that, just as you've presented, you're mindful, I think they should help you to put you in check. But if you're in a position where you don't want to listen or accept feedback, then perhaps now those are the issues that come with it, the disorders and so forth, I think. Yeah, so can I move on with the next one?
Yes, please.
Okay, so this is from Ashley. Ashley asks, you mentioned PMS earlier. What is the best way to deal with it medically? Antidepressants advisable to take to manage it, and is it preventable?
Okay, PMS is premenstrual syndrome. Most of it is biologically. Usually taking an antidepressant, really per se, I think that would be on the, how can I say, on the higher end, like when you really need it. But most of the time, we advise people how to deal with PMS, because it comes with also moods. So you try to find something or to do things that actually will produce those, I call them endorphins, the feel good hormone. So one of the some of the treatments, usually there are two forms of treatment when you're treating a mental disorder. It's usually through medication and through behavioral changes, which is called cognitive behavioral treatment, where you actually implement forms or lifestyles that can enable you to cope with it. I don't recommend taking antidepressants for PMS because it's hormonal. It's something normal that it occurs with your cycle. So taking antidepressants is for the, I can say for the long run, but it requires a lot of monitoring, because once you are on antidepressant, you cannot stop. We usually tether them till the end. You cannot just stop them abruptly. But PMS usually happens right before your period or during your period. So it's a few days of the month, and that is because it's attributed to the surge of hormones preparing your body to having the menstrual cycle. So it's not advisable for you to take antidepressants for PMS unless it is prolonged. It's more than your cycle days, but you still, again, have to go through a mental health evaluation status. Because one thing I think I should overemphasize about these medications that are given to take for mental illness, they require a lot of monitoring, because they are functioning at a higher level at your brain. So the best way to treat PMS is to try exercising, eat healthy way before your period comes, prepare your body to experience it. Like maybe by eating healthy and exercising, you're actually reducing your body reaction to the pain and to the cramps. And if the cramps or the pain is unbearable, you can take anti-pains for the pain. Usually PMS comes with the pain, like the physical pain. So because of the physical pain that you're going through, it actually sometimes makes you moody. But because it's not something that stays for a long period, please don't take antidepressants. Find something or do something that can make you feel good. Sometimes some people actually recommend chocolates, because chocolates produce the endorphins that makes you feel good. They are the same as when you're having sex. I'm sorry to say this, but you know, when people are having sex, they produce these hormones that make them feel good. So studies have shown taking chocolate is almost equivalent to producing those endorphins that makes you feel good. So I hope I've answered that question.
Yes, I believe that was, sorry, Ashley. Ashley is that got addressed very well. Thank you, doctor. So today we are really enjoying the free consultation. I see. So thank you so much for that. I think there is a question here by Jennifer. If someone who identifies himself or herself as a social introvert, prone to panic and or anxiety disorders, is thinking of harnessing a certain skill that requires them to put themselves out there, like public speaking, how would you advise them to go about it? Is that clear?
Yes. So
Okay.
first and foremost, panic disorders, they actually sometimes they are called what we call medical emergencies. If you've seen someone going through panic attacks, some people they're unable to breathe well, and they require immediately medical attention. So if you're a person who feels like you're an introvert, as I said, me myself, I'll try to explain or to use myself as a reference. As I said earlier, I have been medically diagnosed with having an anxiety disorder and a borderline personality disorder. I think it's 7 years that I've been through treatment. Thank God right now I'm not on any medication, but I was on medication for about 3 years. So one of the things that actually helped me to actually reach this stage, to actually accepting fallacious proposal to do this, was one of the things that my doctor actually told me. In the beginning, I used to feel to get like anxiety attacks just to stand up and talk to people, or when my teacher will ask me to present something, or just to answer a simple question in school, even if I know the answer. So one of the things that my psychologist recommended during my session was to try and find ways. One of the ways was to write down my strengths. Like, I want to be able to be better at public speaking. So find topics that I'm very sure, or topics that I'm very fluent about, or things that I can easily speak about. And before presenting, I should prepare myself, or I should practice mindfulness. Like, have a session, like maybe you can go stand in front of a mirror, which is something that I did before this presentation, and imagine people are there listening to you, and go through it. I don't know if I'm making sense. Like,
you do a lot.
imagining, yeah, you're standing in front of the mirror, you're looking at yourself, and you're trying to imagine people are around you, and you say it loud, and you practice it like a lot of times, and you feel, and as I said, you choose something that you're very comfortable with, or something that will boost your strength. If you choose a topic that you're very good at, you'll be able to express it well because it's your strength. You have enough knowledge about it, and chances are you'll not make a mistake about it. So one, that is going to build your self-confidence and your self-esteem. And then practice makes perfect. So keep doing it day by day. You get better at it, and being self-aware and being willing to accept the the external evaluation that you get. And another thing is, sometimes I usually carry a bag that helps me with breathing. There are yoga classes that you can take. You can find them online that helps you with your breathing. That it helps, it makes you calm down internally. So by the time you're going in front and you want to present that speech, you've already, to avoid panic attack, you've already prepared yourself mentally by doing these exercises and by going through it over and over again, and you know this is something you're good at. And also you can carry a bag. Usually I usually use a glove sometimes when I'm at work, or just a plastic bag, and just practicing breathing in and out with it. It helps calm you down. And if you're in front of people and you feel like you can't, usually if you're in a stage, one of the tips we are given is look above their head. You know, sometimes it's very hard to maintain eye contact, but if you look above their head and you close down all the external factors, that's why I say, by standing in front of the mirror, you're just yourself. I don't know if I'm making sense.
Yes, you do.
Yeah, and I hope that does answer your question. But if you feel like your panic attacks are very severe, you should also seek medical advice and have a doctor review you. And if you are required to have medications, they will initiate the medications for you.
Thank you so much, Doctor. I believe Jennifer is well answered. Yeah, I think that you also gave us some good tips for public speaking as well, and dealing with panicking. But also I think it's just generally, I think, so, yeah, anxiety can just come even if, you know, you can be too confident with these things.
Yes.
So thank you for that. Yeah, I now will, okay, this is Mildred. I have dealt with anxiety disorder for some time, and through therapists, I have learned to control the triggers. Thank you so much. Well, okay, yeah. So I see all people have well addressed, their questions are well addressed. I don't know if there is any question from the audience or anything from Miss Josephine as well. Anything to say? Anybody who has anything to say? We have like 3 minutes to go. Yeah. Okay. So otherwise, maybe just to add to that, I think from the lessons and all, I hope most of us are going to break the stigma, you know, with relations to the topic of mental illness, and that, you know, I think everybody or anyone, like, you know, we just we're all at risk of being into it, but you know, and you never know, like this, all the situations that you have said, some are psychological, some are hereditary, some are environmental, you know, anything can happen today. You can be maybe fired from a job, and the next thing you know, you are stressed, you are depressed, you are, you know, you're having this mental illness and all. So just as you said, you know, we shouldn't assume things. We shouldn't really take things into our hands. We should be aware to what extent is this thing affecting us, get a medical support, and maybe people close ones, as you said, and it's treatable. So that is a sure thing, you know, that, you know, we know we can get through this, however way, maybe, yeah, whatever way. So that for me is my takeaway. I don't know, I'm just speaking just to see if there's anyone having anything to say. But I think it's been a great session. People have been commenting. I hope you've been seeing the messages.
I'm actually trying to read them now.
Okay. So people have commented, like it's been a powerful session, insightful one. Okay, so I believe we have no questions. All right, so it's been a great time. It's been a great session. So I hope we can put to work these things and we can work on our assignment accordingly. And, you know, let's keep on reflecting on these things. If you have a loved one, you have a relative, someone you know who is going through these things in one way or another, you know, these challenges, and please let us be a supporting hand. Let us be, you know, that supportive person, to understanding them, to educate them, to, you know, to walk with them through the journey. We should not be the people that, you know, stigmatize people or something like that, you know, and calling all these names, the psycho, I think those English words, you know, are the harming one. Yeah, so we use them. We see them in movies and things like that, the bipolar, the what. We make fun of them sometimes. and even making fun of ourselves when we act like those. So I think those are things to really help one another. And let us not be in self-denial when someone really, you know, even if it's an element or it's a symptom, just, you don't have to attack them or to say like, no, I don't. Just, you know, just be quiet and start observing yourself, and maybe try to improve yourself or something. Okay, so doctor, I'm sure you're looking at me and say, you know
you're
better.
doing a great job. No, you're doing a great job.
Yes, so we'll come to an end of this. Till next week, let's be on time. So we have noticed that people start a bit late. I'd like to encourage each and everyone, let's please try to keep time, but where you can't, it's also fine. But yeah, we otherwise, you know, you would be missing out or something like that, or which, you know, I wouldn't recommend. So let's really try to be on time, and we do work on our assignments. Let us fill the evaluations, and you know, keep the fire going. So otherwise, thank you so much, our wonderful facilitator of today, Dr. Zainab. Thank you so much. Yes, Miss Just, I think, yeah, guys, she did awesome. You did well. You did wonderful, and it was really great. We all learned today. Yes.
Thank you very much for having me.
Yes. So thank you also, Miss Josephine. There've been a team of facilitators and everyone who has been able to join us, participants. Thank you for your time. Till next week, have a great night and have the best ending of the week. Till then, bye-bye.
Bye-bye, Felicia. Bye, team.
Bye-bye.
Bye.
Bye.
Okay, bye. Thank you, everyone.